infectious disease, and is also, and has been since 1984, the director of the NIAID at the National Institutes of Health. There he oversees a fairly massive research portfolio in basic and applied research, focusing on established as well as a whole host of emergent diseases. His own personal work is focused more on HIV/AIDS. Currently, I believe the budget of NIAID exceeds $4.5 billion a year, and many of you probably are the beneficiaries of research grants from NIAID, so we thank you for that. Now, Dr. Fauci, as I said, is really one of the most renowned biomedical scientists in working in infectious diseases ever. He served 5 U.S. presidents on various task forces and various roles. Also the U.S. Department of Health and Human Services. For example, has been one of the principal architects of the PEPFAR initiative, which is the President's Emergency Plan for AIDS relief. His personal research program has made numerous seminal contributions to our understanding of how HIV destroys body defenses and leads ultimately to the susceptibility that creates secondary consequences of numerous infectious and other immunologically mediated diseases. He's also been incredibly instrumental in the development programs, the drug development programs that have led to treatments that really fundamentally changed the landscape of HIV from an acute, life-threatening illness into really a chronic and manageable illness. He's been honored by countless societies. Some of them I'll just mention because they're probably well known to many of you, such as the Presidential Medal of Freedom, really the highest honor that a president is able to confer on a scientist. He's received the George Kober Medal from the AAP, the Lasker Award for public service, and remarkably, I think at last count, has received 43 honorary doctoral degrees. And that may be outdated, I'm not totally sure. But let me just also say, Dr. Fauci is renowned for his ability to communicate complex concepts and to really impact the health of the public in so many different ways. And I think it's for all of this that we are truly honored to have you here to address us. And so please welcome me, or join me, I should say, in welcoming Dr. Fauci. Don't welcome me.
Thank you very much, Harvey, and welcome. Thanks, Harvey. I appreciate that very kind introduction. It's really a pleasure to be here with you this morning to talk about a subject, as you see indicated on my first slide, and I'd like to talk to you a little bit about that. And I chose the title, Emerging and Re-Emerging Infectious Diseases, from AIDS to Zika, because I want to put it into a real-world context of what happened several months ago. I mean, as most of you know from my name and indication that I'm at the NIH, and I've been in Washington, D.C. for a very long period of time, and I've had the opportunity to serve under 5 and now 6 presidents of the United States. But an interesting thing happened following the election of President Trump and the time between the election and the inauguration. And what happened, as some of you may remember, a number of individuals were named to be the soon-to-be cabinet members of the Trump administration. And so Dennis McDonough, who some of you may have heard of or not, Dennis McDonough was the long-serving chief of staff to President Obama. A really terrific person. He was in the Senate with Senator Daschle before then, and I got to know him very well. And what he decided to do, which was a good idea of reaching out to the new administration in January, before the actual inauguration, he organized at the White House getting all of the cabinet-to-be members of the Trump administration, Mattis, all of the others, and Tom Price from HHS, everybody at the White House, and had an exercise. And the exercise was, we want you to benefit from our experience over 8 years of the Obama administration. And for certain, you are going to be likely within the first several months of your administration confronted with unanticipated emergencies. So he created a tabletop exercise in which he said, let's say that there's a possibility that 4 things may happen to you. 1, there may be a terrorist attack with bombs and bullets. 2, there may be a cyber attack. 3, there may be another Hurricane Sandy. And 4, there may be an outbreak of a pandemic. So he brought several of us together at the White House, and he asked me, Tony Fauci, Tom Frieden, who at the time was the CDC director, and Secretary Burwell, who was the Secretary of HHS, to cover the part about the possibility that there would be an unanticipated outbreak, and how does that work? What does an administration do? It was really quite an interesting exercise. Little did we know at the time that we would see one of those 4, which was hurricanes Irma and Jose and Maria and everything else. But that's not why I was there. I was there to talk about what happens when you get emerging and re-emerging infections. So I'm going to actually talk to you about what was discussed at the formal meeting in a room a little smaller than this, obviously, but in and around the halls of the White House, talking officially and unofficially. So this is what was reported in a publication that's very popular in Washington called The Hill. It talks about what goes on in the Washington area. It's a local sheet. And they reported that the White House holds a disaster response exercise with the Trump officials. So when I got up for the time that I was allotted, I said, well, let me just tell you about my experience. I showed this. I have been the director, as Harvey said, of NIAID since 1984. So that's been over 33 years. And I've had the opportunity, and this was what I looked like back then, a little less gray hair, tells you what this job does for you. But I had the opportunity of serving for 5 presidents. And what I discussed with them was the interesting little quirks of things that happen in the realm of what we're interested in, is infectious diseases, outbreaks. And I started off by telling a true story, and it's not hyperbole, it was true, is that with all of the things that go on in Washington, often, as you know, you read it in the newspapers and see it on TV, we get asked to testify before the Congress. And one of the things that congressional leaders in the Senate and the House like to have hearings on is when there's things like outbreaks. And I've been a lot of outbreaks. I've had the distinction, it's true, I don't know whether it's a good distinction or not, is that I have testified before the United States Congress more than anyone else in history. And it's the truth. And the reason is it's a combination of multiple outbreaks, and I've been doing it for 33 years. So I've testified officially, not briefing, but official hearings about 270 times over the last 30 years. So what I did is I told them, I said, you know, when I first testified early on in the mid-1980s, 1984, I drew a map of the world, and I wanted to bring out that we have emerging and re-emerging infectious diseases. So I showed this blank map, and then I showed the next one, which was this one that I was heavily involved with, because this was 1984, the first 2 or 3 years of HIV. So I put on the map HIV, and I told them that I showed a version of this slide every single year that I testify before the Congress. And they never get bored with the slide, because each year I add either 1 or 2 or sometimes 3 either new emerging or re-emerging infectious diseases. So this is a version of the slide that I showed in April of 2017. And that is what you have. I mean, some of these are trivial, non-consequential outbreaks. Some of them are transforming. And this is deliberately made so that they couldn't read it, because I wanted to impress upon them how profound the effect of emerging and re-emerging infections. So I said, let's go through some of the presidents. So the first one that I had the opportunity to serve was President Reagan, who, as you know, served for 8 years from 1981 to 1989. With regard to emerging infections, clearly the disease that dominated the early part and the mid and throughout his presidency was HIV/AIDS. And I'm sure many of you remember the original reports from the CDC, first in June of 1981, of 5, curiously, gay men, all from LA, all previously well, who presented with a strange kind of pneumonia seen only in immunosuppressed individuals. I remember that very well, sitting in my office at the NIH in the early summer of '81. I saw that. I thought it was a fluke. I thought that this was maybe they took some toxic drug that suppressed their immune system. I didn't make much of it until 1 month later, in July of '81, when another MMWR appeared. This time, 26, curiously, all gay men, not only from LA, but now from New York and San Francisco, again, presenting with strange diseases, pneumocystis, now Kaposi sarcoma, and other opportunistic infections. And I often tell the story that I had been at the NIH at that time for about 9 years. When I finished my chief residency in New York, I came back down and I was working on the interface between the immune system and infectious diseases. And I had a pretty successful career at the time. But when I saw that MMWR from July, I said, I really need to turn around the direction of my research and what I do. And remember, this was before I became director. I was just the lab chief at the NIH. I was seeing patients and doing all the things that you do in the lab associated with patients. But my mentors thought I was crazy. They were saying, why do you want to switch directions of your career and study a handful of gay men? And remember, they were all gay at the time. The reason I'm telling you this story is because I have a lesson for each of the presidencies. The lesson is pay attention to things that are going on because they could explode. So I decided I was going to stop doing what I was doing and admit, and we filled our wards at the NIH. That I'm in charge of a 52-bed ward, and about 35 of the beds were immediately occupied by people with a disease that we didn't know what it was. We had no idea what the agent was, and they were all dying. So I had to explain why I was doing this. So I wrote an article, and if you look at the date on this article, I wrote it in the winter of 1981, and it didn't get published until the spring of 1982. And I call this my Apologia Pro Vita Sua. For those of you who have had the opportunity of studying Latin in college, like, why did I study Latin in college? But I did. It means an apology or an explanation for my life. And the reason is that I wanted to tell my mentors why I was studying it. And unfortunately, this was one of the most prescient things that I've ever written. I sent it into the New England Journal of Medicine, who rejected it because they said I was being too alarmist. One of the reviewers said I was being too alarmist. So I sent it into the Annals of Internal Medicine. And this is what I said, right there. Because we don't know the cause of this syndrome, any assumption that it's going to be restricted to a particular segment of our society is truly an assumption that is without scientific basis. Now, unfortunately, that was one of the most true things that I have ever said in my career. And the thing that characterized, retrospectively now, the Reagan administration was the beginning of the activist movement of the gay activists trying to say, you're not paying attention to this disease. Right before our eyes, it's exploding. And this is one of the famous signs that we see of silence equal death, and that's from the ACT UP New York group that began to call attention to this. So as we were not paying attention to an outbreak, fast forward 36 years, and now we have a total of almost 80 million people having been infected, currently 36 million people living with HIV, about 2 million new infections a year and 1 million deaths. So the lesson is that outbreaks sometimes insidiously come up on you and are not explosive always, like a pandemic influenza. So we went on to the next administration. Again, George H.W. Bush was dominated in many respects, again, by HIV/AIDS. But he was different because when he was vice president and was considering running for the presidency, he realized that something was going on here that the federal government needed to address. So he had heard, remember, I started off on this in 1981. He decided to run in 1988. And by that time, I was pretty well known as somebody who was out there pushing the agenda for HIV. So what he did is that he decided he was going to visit me at NIH and essentially get a mini tutorial on what was going on with HIV. And to his great credit, he was very open-minded about it. So here's a picture that I'm going to show you. I met with him. I spent a half a day to a day with him. We became very close, and he became very much back and forth asking me questions about HIV. As soon as he became president, he lived up to his promise, saying, one of the first things that I'm going to do is I'm going to address HIV/AIDS. So we came to the NIH, and this is the picture of him, and I'll give you a close-up in a minute. In my solarium, in the clinical center, for any of those of you who've been to the NIH, at the NIH Clinical Center on the 11th floor, which is my ward, and we have kind of a group meeting every week with our patients to just talk about things in their life. So I invited him, and he was here shown with Barbara Bush. The fellow in the middle with the three-piece suit is one of my patients. Remember, this is before therapy, so everybody in this room who's an AIDS patient is now dead because all of them did the way so terribly we've seen. But he came and he wanted to hear. There's a picture of me in my white coat showing him around. And that's when the real interest in putting federal funds into HIV came. I want to point out one other person in that room who went unnoticed except for me. And this is a person sitting in the side. Anyone recognize him? Okay, so that was the president's son when he was a staffer in the White House. So before he became president of the Texas Rangers, before he became the governor of Texas, he was a staffer in his father's White House. Quite effective too, kind of below the radar screen, but he had a lot of influence. So I got to get to know him then, way before he became president. And I'll get back to that in a second because this becomes very relevant about how things get done in Washington. I learned then, and subsequently multiple times, a great rule in Washington is be nice to everybody because you never know where they're going to wind up. And this is a typical example of that. So what happened during the George H.W. Bush administration is that the budget, as shown here, exploded. We went from almost nothing with HIV to a considerable amount of money, as shown. If you look right there, that's the years when he became president, 1988, 1990, and that's what happened with the AIDS budget. What did that prove? That when you make investments of resources into biomedical research, particularly related to emerging outbreaks, good things happen. And I think AIDS is a phenomenal example of the advances in science from 1981 to today in the areas shown on this slide. It's a great example that when you make investment in resources, you can solve the problem. And that's exactly what happened with HIV. And why we put so much money into that is a complicated, really interdigitating effects of social issues, the power of the activist community, but it happened. I could spend the entire time talking about each of these blue boxes, but the one that's had the most impact has been in the area of treatment. And I think there are people in this room who may have had experience there. So this is a picture of me on typical ward rounds at the NIH hospital. And I'm there by the bedside of a patient who was HIV infected, but we didn't know it was HIV at the time because this is 1982. So remember, the virus was identified by the French in 1983 and proven to be the cause in 1984 by Bob Gallo. So this was before we even knew what the virus was. The reason I show the picture is to remind myself and to tell you what it was like then, because the median survival of an individual, remember, they all presented late. It's not like today where you present well with infection. The only time you went to a doctor was when you were really sick, and it was then that you realized you had this new strange disease, almost certainly because you were also a gay man at the time, and then it was only later that other demographic groups came in. But what happened with the investment? Over years, we went from nothing to now at least 30 FDA-approved drugs, which were given in combinations, have completely transformed the lives of HIV-infected individuals. And if you want to, as a biomedical community that we are, point to one thing in which an investment in science completely transformed the field, it was in HIV, because back then, as I mentioned, the life expectancy of someone who presented when they were maybe 25 years old with advanced disease was about a year to at the most 2. Today, in that same room that I see patients, if a young 25, 26-year-old person came in with newly acquired HIV, and I started them on 1 pill a day that contains 3 antiretrovirals, I could look them in the eye and honestly tell them that by actuarial curves, I could predict that they would live an additional 50 years. Which means if you're in your mid-20s and you live an additional 50 years and you're a male, you have almost a normal